We are excited and honored to have Dr. Heather Woolery-Llyod here with us today. She's a world-renowned, board-certified dermatologist based in Miami. And Tasha and I have been fans of hers for years. Like I said before, we have interviewed her countless times, and we can always count on her to give us practical advice on how to treat our skin. And she's one of the tops in the world when it comes to working with skin of color. So who better to have with us here today than her? And we want to get to as many questions as we can today. She's in hot demand, I must say. She books appointments months in advance, and you get her all to yourself for the next 60 minutes or so. So we want you to take full advantage of your time here today. So sorry for the little delay in the beginning, but we're going to get to as many questions as we can. And again, like Keisha had to do, it may be helpful if you mute your microphones if you're part of our video panel at the bottom until you have a question, and that will help us control some of the noise factor. And again, if you're joining us out in cyberspace, we want you to fully participate in this chat. We want to get your questions too, and you can do that via the chat box on the right-hand side of the screen. Just type it in like a text, and press post, and we'll see it, and we'll make sure that Dr. Woolery-Llyod gets to your questions as well. So if no one has anything else to add, we'll just turn it over to Dr. Woolery-Llyod.
Thank you so much.
Hello, everyone. I'm so excited to be here and really to answer everybody's questions, because I know when you go to the dermatologist, you get all of your questions answered, but a lot of us may not have an opportunity to spend enough time with your dermatologist to get your questions answered. So I'm really excited, and I'm ready to hear your questions.
Great. Does anyone want to kick it off, or should I pull a question that I have from email? Diane, would you like to go?
My biggest question is about anti-aging. Can you hear me all right?
Yes, I can hear you.
Okay, it's about anti-aging. I'm 61, and as I get older, I notice a lot of uneven tones in my skin, particularly the darkness under my eyes, and I'm just wondering if there's anything I can do from my end other than spend $1 million on concealer to help this problem.
Well, you know, that is a very common problem. I would have to say one of the most common things that people ask me about are dark circles under the eyes. And dark circles, there are many reasons why we get dark circles. One of the reasons why is because the area under the skin is thinner, under the eyes are thinner than the surrounding areas. So because the skin is so thin, the blood vessels are a little more superficial. So you see a little bit of a shadow from the blood vessels that are in the skin in that area. The second reason why is because our eyes actually sit in a little fat pad. So our eyes are actually surrounded by fat, and as you get older, that fat shrinks and it tends to recess a little bit. So you get a little shadow under the eye, and that contributes to the dark circle. And lastly, there's pigmentation. So you can get a little hyperpigmentation under the eyes, especially if you have allergies or you have itchy eyes, and with chronic irritation, you can get a little bit of darkening of that area. So there are multiple things that contribute to dark circles under the eyes. So to address those issues, there are some products that contain caffeine that helps to constrict the blood vessels underneath the eyes, so you get a little bit less of the shadow from the blood vessels that are under the eye, under that very thin skin. And then you can also use products that treat the pigmentation, that treat the hyperpigmentation from those dark circles. So the fat pad obviously is something we can't control. That's just natural aging. That fat shrinks, and then we get a little bit of a shadow. But one of the things you can do for that is actually fillers. So we can inject a little bit of hyaluronic acid. It can be Restylane or Juvederm or whatever filler of choice, and that helps to fill in the indentation that you can see. Blood vessels that are under the eye, under that very. So, sorry, we had a little bit of feedback there. So, so those are the three things that three things that you can do to help address that. I think that's just natural aging. You might have to mute your.
You have to keep yours on mute.
Keep yours on mute. Fillers, so we can inject.
Thank you.
Great. So, so those are the things we can do. We can use products that contain caffeine, products that help to fade darker skin if you have some hyperpigmentation in that area. And then you could also see a dermatologist and get a filler. And if you do that, you can help to that treats the indentation that we see from the shrinkage of the fat pad. So dark circles are definitely a challenge. They're definitely not one of the easiest things for us to address, but we're definitely getting new products out that help with those, but definitely a challenge. It's something that a lot of women complain of. One of the things you can do to prevent it, though, is to wear sunscreen every single day. I find that if you're consistently wearing sunscreen, at least you can prevent the pigmentation part of the dark circles around the eyes, so that later in life you can prevent them. So for those younger people out there who maybe have a family history of hyperpigmentation under the eyes or dark circles, wear your sunscreen, because that really can prevent it.
Great, thank you so much. Can I just ask one more question?
Sure.
In that situation, do skin lightening creams under the eye, would that help?
Skin lightening creams, you have to be very careful with under the eye, because as I mentioned earlier, that skin is very thin, and so it can be much more sensitive to a cream that, let's say, you use on a pimple that fades a brown spot from a pimple, but in that thin skin under the eyes, you're more likely to get burning, sensitivity, and irritation. So the vast majority of skin lightening creams are a little bit too irritating for that area.
Okay.
Now, if especially the ones that contain hydroquinone, that typically is a little too strong for that area. Now, there are some skin lightening creams that have natural ingredients like arbutin, licorice, soy, and those creams can help under that area. But in general, you do have to be careful with that sensitive area under the eyes.
Thank you.
And Dr. Woolery-Llyod, you mentioned injectables under the eyes. How long does the effect last?
Well, injectables in that area actually last quite a long time, and that's because we really don't move that area that much. So when we inject the nasolabial folds or the laugh lines, we're always talking and smiling, and so in those areas they tend to last maybe anywhere between 4 to 6 months, maybe a year. But under the eyes, it's much more likely to last 6 months to a year or more, because it's not a very mobile part of the face, so it's actually a very economical solution if you choose to do that.
Great.
Now, this is a question to piggyback on. I have a question here through email to piggyback on sunscreen. Where are the places or the key places that you should be placing your sunscreen?
So we need to place sunscreen on the full face every single day. When patients come in to see me, the vast majority complain of uneven skin tone. That's their primary complaint. And I live and work in Florida, and the first question I ask those patients is, do you wear sunscreen every single day? And most people say no. So the most important thing is to wear sunscreen on the face every day. If you do that, that's at least half of the battle. But another common location to get brown spots are the hands. Sometimes people will forget, but as you get much older, on the neck and chest, you can see some signs of aging just from chronic sun exposure. So in addition to the full face, if you're really motivated, I'm happy if you just do the face, because that's the most important part. But also your chest and your hands are an important area to add, especially if you live in a sunny climate like I do, Florida, California, where we get sun every day, year round. It really has a cumulative effect. So daily sunscreen use is important.
Okay, nice.
Got it.
We have a question here from the chat room. And
Yes.
I'll read it to you. It's from Sandra in Maryland. She says, good morning. I have a vitamin D deficiency, and I'm taking prescription 50,000 IUs of vitamin D once a week. Should I use sunscreen or sunblock? If so, what type should I use? And will it totally block absorption of vitamin D from the sun? Oh, so it's the vitamin D and what the sun does with the synthesis of it.
That is a fantastic question, Sandra, and thanks for asking that. Actually, if you're taking vitamin D supplements, then you don't need to get the vitamin D from the sun. So it's when the prescription supplement should bring your vitamin D levels up to normal, and it's totally fine to use sunscreen every day. In fact, the American Academy of Dermatology does recommend that if you have vitamin D deficiency, you get the vitamin D from a supplement, because the risks associated with getting excessive sun exposure don't outweigh the benefits from getting the vitamin D from the sun. So it is much better to take your vitamin D supplement, then you're just getting it internally, and you don't have to worry about getting it from sunlight. And it's very hard to get your vitamin D from the sun anyway. I'm vitamin D deficient. I live in South Florida, and we have sun around us all day, every day. And there are studies that looked at surfers in Hawaii who are vitamin D deficient. So really, if you truly have vitamin D deficiency, the best way to increase your vitamin D levels is with oral supplementation with prescription medicine or over the counter.
Great.
Thank you. That was a great question. Thanks, Sandra.
Keisha, I see that your computer, the computer is working a little bit better as far as sound. Do you have a question for the doctor?
Yes, I do. What do you recommend for body acne, like chest and back acne?
Okay, Keisha, I'm going to answer your question, but you have to go on mute again because unfortunately we have that feedback.
Okay.
Thanks, Keisha.
Great. So, so for acne on the face, chest, and back, so the face is easy. You know, we have many prescription treatments and over-the-counter treatments, but definitely chest and back acne, and even acne on the behind, which is a common problem, is a little bit more challenging to treat because it's so widespread. So for those things, I usually recommend a prescription wash, and you need to look for ingredients like salicylic acid or benzoyl peroxide. Salicylic acid typically comes in a 2% formulation over the counter, and benzoyl peroxide comes in either 5 to 10%. Both of those can be used every day. I tell my patients to put those in the shower so you remember to use it. And if you can leave it on for a few minutes, so maybe apply the wash and then shave your legs or do something else so that you get some short contact, maybe a minute or two. It doesn't need to be a long time, but some short contact with that benzoyl peroxide. You can see significant improvement just with that simple intervention. But if you have more severe acne, you might need to see a dermatologist for prescriptions. And we have some really good new prescription treatments for acne that are specifically designed for the chest and back. So they come in a foam formulation, so they're easy to apply. Because can you imagine getting a little tube of something and trying to apply that to your entire chest and back would be difficult or almost impossible. So we have a lot of new prescription treatments that contain, that come in a foam, so they're easy to apply to large areas. And just in case you can't see a dermatologist or you want to try over-the-counters, in addition to those medicated washes, there are lotions, benzoyl peroxide and salicylic acid lotions that you can use once or twice daily, and they will give you some improvement over the counter also.
Great. What role does exfoliation play in all of that with treating acne?
Exfoliation, I think, is really helpful, but you have to do it in moderation. I think most people's natural instinct is to try to scrub the acne away, and really that doesn't work and usually makes it worse. People get irritated. I see a lot of people come in with almost, burns from trying to scrub too much at the acne on their face, chest, and back. So exfoliation once or twice a week if you're using a brush or if you're using a scrub, maybe anywhere between 1 to 3 times a week. If you have really oily skin, you might be able to get away with it every day, but most people don't. And then you can see some improvement. I definitely think it can be helpful, but we have to use it with care and caution and not over-exfoliate because then you run into more problems.
Okay.
Now, Lizzie, I know that you have a question about acne. Do you want to ask the doctor?
Yes. I have very sensitive skin. Like most of the acne products, it makes me have an allergic reaction. So I was wondering what products would you suggest for it?
Well, sensitive skin acne is something that's very common in adult women because, when you have acne and you're a teenager and you're younger, you have very oily skin. So it allows us to use all of these products that can be very drying without any problems. But in adult acne, and the vast majority of my patients are women with adult acne, you have to be much more careful. So the first thing you need to look for, you would choose creams and lotions instead of gels. So if you have a choice between a product and it comes in a lotion and it comes in a gel, you would choose the lotion. That's a simple little pearl that you can use when you're picking your product. Other than that, there are prescription treatments that are designed for sensitive skin. One of the ones that I use a lot is called Axone, and it's a prescription acne treatment that's not irritating, and I really like it for adult women with acne because there's no dryness or sensitivity associated with it. The other thing that actually has been proven in clinical studies is to use a moisturizer with ceramide. So my brand, Specific Beauty, has a moisturizer called the Professional Moisture Complex, and that has a patented ceramide that is identical to our normal human ceramides. So if you're using something that's very drying, particularly a moisturizer that has ceramides, has been proven in clinical studies to help improve your acne, because you get less irritation and it allows the acne medicine to work better. Obviously, when you're very irritated, what happens is you use your acne medicine less. So the two keys would be look for a lotion or a cream instead of a gel. And the second thing is add a moisturizer with ceramides to your regimen, so that if you do get irritated, you will calm that irritation and it'll allow you to continue to use your acne medicine to get results.
Okay, thank you.
Dr. Woolery-Llyod, can you explain what a ceramide is? Because people have probably seen that in other skincare, not just acne, but skincare moisturizers and things like that.
That's a great question. Ceramides are one of the natural lipids in our skin. So naturally in our skin we have lipids, like we have cholesterol, we have fatty acids, and we have different things in our skin that keep our skin moisturized and hydrated. And ceramides form almost a plate-like barrier on our skin to keep what I always say is to keep the good things in and the bad things out. Mm-hmm. So our skin, of course, is the largest organ in our body, and it's a natural barrier. So ceramides are one of the most important lipids or fats in our skin, or oils in our skin, that helps to maintain our barrier. And that's why they're particularly helpful in acne treatment, because things like retinoids, such as prescription retinoids, those are Retin-A, Tazorac, Differin, and then over-the-counter retinoids, and those include retinol. That's probably the most common over-the-counter retinoid. Those can really strip the skin and cause dryness. So it's important to replenish that barrier, and ceramides have been proven in clinical studies for people with acne specifically to help restore that barrier and make acne treatments more effective.
More effective. Thank you for the explanation.
Yes.
We have a question from Carla in the chat room. She says, my 12-year-old daughter has horrible scars on her legs from years of eczema. Any advice on helping her with this?
That is another common thing I see in Florida. Of course, we have this warm, sunny weather, which means people are wearing shorts and skirts every day. And I really see this problem from mosquito bites here. People who I'm sure there are many of you out there who get mosquito bites in the little dark spots on their legs, and of course with eczema. So the most important thing with dark spots on the legs is to try to prevent them. I know she already has them, but she probably still has a little bit of eczema. So make sure that her dermatologist or her pediatrician is treating her eczema appropriately, so that at least you can prevent new ones. That's the first thing. So make sure she's using a strong topical cortisone cream as soon as her eczema flares, so that we can calm it down before the dark mark comes. And the same thing with mosquito bites. You can use a topical hydrocortisone or something from your dermatologist so that you can prevent the dark spot from occurring. Once the dark spot occurs, it can be a little bit challenging, but we can get them better. So the few things I do in my practice, I do tend to use natural products that help with hyperpigmentation that don't contain hydroquinone. We have a product that's called the Dark Spot Corrector Pad, and it's very useful for the legs because you can apply it to a large area. I recommend a sunscreen on the legs that also contains ingredients that help to treat the hyperpigmentation. So sunscreens that contain niacinamide or licorice, in addition to protecting you from the sun, can help to fade those brown spots at the same time. And the last thing I sometimes do in my adult patients are chemical peels. So they'll come in monthly for a series of 3 to 5 peels, and we can see some gradual improvement in that hyperpigmentation over time. Now, the one thing we have to be careful with eczema is preventing any activation of the eczema. So you don't want to do something to try and fade the dark marks and kind of make your skin more sensitive and more itchy. So you have to be careful to choose things that are non-irritating. And that's why in the eczema-prone patient, I would not use hydroquinone on the legs, because that could cause a little bit of irritation. So try to prevent it, really get her eczema under control, so at least we can prevent the future ones, use a sunscreen on her legs that also contains ingredients to help fade brown spots, and then use a product with natural ingredients that does not contain hydroquinone, because on the legs, especially in someone with eczema, it could make the eczema worse.
Great. Thank you so much, Carla. I also have an email question here from Melissa, and it's along the same line. She says that her son licks his lips all the time, and that he gets the dark ring under his mouth. What can she do to protect that area?
So that actually has a name. It's called lip licking dermatitis. It's a common thing that we see in kids, and you can even see it in adults. And really, it's because of the basically irritants in our saliva. When you constantly lick your lips, it removes those oils. Remember earlier I was talking about the natural lipids or oils in our skin? So you start to strip the oils. And then we have some irritants in our saliva that causes it to get a little bit dry and irritated, and it becomes a little bit of a cycle, because then you feel dry and irritated, so you lick your lips, and that cycle continues. So it's really important with lip-licking dermatitis is, first of all, to try to explain to your son that licking the lips makes it worse. And I know it's a habit and it's hard to break that habit, but they have to make a little bit of an effort to do that. Now, the second thing you can do is use a petrolatum-based product that forms a barrier, so you can restore that barrier around the lips. So if you use a petrolatum or petroleum jelly, anything that's a really heavy Vaseline, you can restore that barrier. Especially for a little child, you can use it at bed before he goes to bed at night. Cover the lips so at least that you can get some restoration of the barrier. During the day, it might be a little bit difficult because of cosmetically it might look a little funny, but definitely at night and as much as you can at home, keep the lips covered with Vaseline so that the saliva doesn't irritate the skin. And then if it still doesn't resolve and you've tried a Vaseline or petrolatum and a hydrocortisone ointment, then see your dermatologist, because there are some prescription ointments that we can use that also help with lip-licking dermatitis. But the most important thing to do is to stop licking the lips, because it's a little bit of a cycle, and once we break that cycle, the skin tends to resolve, to improve.
Great. Thank you so much, Melissa. I also have another question from email that talks about hair, which I think is a great topic. And with all the weaves and wigs that she wears, how can she protect her scalp so that it doesn't irritate I guess?
So, well, did she say specifically that she's using weaves or wigs?
She said she does both. She switches off. She does wigs sometimes to put her hair on bed rest, and then, sometimes she puts weave and it's for style. Okay.
So that's definitely a problem for some people and it sounds like she has scale. What did she say specifically what her problem was? Was it scale or itching or irritation?
What she said is she gets irritation and, I guess her scalp gets dry and itchy.
Okay.
And then she doesn't she's always afraid that her hair is going to fall out. But, she's a woman, so she wants to wear her style.
Yes. Okay, I understand. So it sounds like she might have sorry, I have a little cold. Seborrheic dermatitis. So that is a fancy term for dandruff. Dermatologists, we always use, these big words to describe simple things, but the medical term for dandruff is seborrheic dermatitis. And it gets even more exacerbated in women who wear weaves and extensions and sometimes with wigs. So the great thing about seborrheic dermatitis is that it's very easy to treat. And the first thing I would suggest is over-the-counter shampoos that contain ketoconazole. So there's probably the most common one is called Nizoral shampoo. And using that once a week might help with that problem. But if over-the-counter shampoos don't work, then it is very helpful to see a dermatologist, because we have prescriptions that really can knock this problem out. We use prescription cortisone creams or antifungals. Typically on the scalp, I might use an ointment or a foam, depending on the hairstyle, and it's really a very simple problem to treat. So I would suggest the first thing she could do is just go to the drugstore and get a ketoconazole shampoo. and use that once a week and see if that helps. But if it doesn't, then she definitely does need to see a dermatologist, but she be confident because it's something that's very easy to treat with topical steroids or antifungal shampoos.
Great, thank you. And I want to interject here quickly.
I want to add one more thing. One of the things I find very helpful for a lot of my patients who have a very dry scalp and want to use an oil on their scalp is coconut oil. And coconut oil is very hydrating, and it's also anti-inflammatory. So you have itching and irritation. Another thing you could try at home before you saw the dermatologist is applying coconut oil sparingly. You don't need to use a lot, but that for some of my patients really helps with the itching and of course the dryness.
Great.
Thank you. And you know, while we're on the question of wigs and weaves, because a lot of black women do wear wigs and weaves, how do we protect our scalp so our hair doesn't fall out? I mean, I know that a lot of it is probably, you know, don't pull your hair because it's a weave, but maybe if you can give your professional advice so that way, if we're going to wear it, we can at least do it in a way where we don't lose our hair.
Yes. So that's a very, very relevant question because it's what I do every single day in my practice is really managing hair loss. And the first thing you can do is avoid tight hairstyles. That's my number one thing. Even if I'm not seeing someone for hair loss and I notice that their hair is too tight, either in a tight ponytail or in a tight, the extensions or the corners are too tight, I always tell my patients, please don't do that, because over time, chronically tight hairstyles cause traction alopecia, and that is the hair loss that we usually see right around the edges. And I think almost everyone has a little component of that, but it gets much, much worse with tight hairstyles. So no tight hairstyles. If you can't sleep the night that you get your weave or your extensions or you have to take Tylenol, that's too tight. And even though the person who's styling your hair might think they're doing you a favor, really it really is destroying your hair. So you really have to be cognizant of not wearing very, very tight braids, extensions, cornrows. That's the first thing. The second thing is to not leave them in for too long, because as the hair gets heavier and it's been in for a long time in the exact same pattern of braiding. So when they corner the hair, if they use the same pattern every time and consistently wear it tight and leave it for long periods of time, that can also contribute to hair loss. So change the pattern of the cornrow. If they do it one way, one visit, do it a different pattern the next visit, so there's not this chronic traction over time, over years and years and years that contribute to it. The third thing is, honestly, consider a natural hairstyle, because natural hairstyles in general are less likely to cause traction. Now, the only exception to that are very long, heavy twists or dreads or locks. So if people have very long locks, very long twists, I'm talking down to the waist, those are very heavy, and you have to be careful because that can cause traction on the hair too. So I think the main thing is to change the pattern of the cornrows, really avoid those tight hairstyles, and consider a natural hairstyle, because if you're really worried about that hair loss from using the braids and really tight hairstyles, just letting your hair out really will prevent that.
Great, thank you.
I wanted to piggyback on that because I have a question here an email question from Lisa in California, Los Angeles. And she is experiencing a little bit of hair loss, says at the crown, I guess up in this area, is that the crown? And she doesn't wear wigs or weaves. She doesn't mention that she does here, but the hair is a different texture, and sometimes her scalp, she says, is actually sensitive to the touch. Is that
that is not traction, and I'm so glad that she asked that question, because it's, again, one of the most common diagnoses I see in my practice. And that condition has a long name. I'll say it so everyone can hear it, but it's called centrifugal scarring alopecia. And sometimes it's called central centrifugal cicatricial alopecia. So I'll break it down for you. Central means on the crown of the scalp, right up here. Centrifugal means that it starts small. I'm going to try and hold up my hand so you can see. It starts small, like this, and then it gets a little bit bigger with time. So it's centrifugal. It gets bigger. Scarring means there's some scarring in the scalp, and alopecia just means hair loss. And it's the most common cause of alopecia, and with traction, it's one of the most common causes of alopecia in my practice. It's most common in African American women. It can occur out of the blue. We don't know why, but we do know it's caused by inflammation in the scalp. And so the main ways we treat it is with topical cortisone creams or topical cortisone ointments. That's a topical steroid, and that reduces inflammation in the scalp. I also, in my practice, do injections with a cortisone every single month for 3 to 5 months. And then we also use hair vitamins and other things to help regrow the hair. So it's very important to see a dermatologist if you have this thinning on the crown of your scalp, because if you catch it early, we can intervene, we can grow back the hair and prevent further loss. If you leave it alone, you're really at risk for that getting larger and larger and having significant balding and significant hair loss. So my advice is see a dermatologist if you have thinning on the crown of the scalp, because you really need to get started on some topical cortisone or topical steroids to help reduce inflammation, and also need to get started on some injections. Usually, not all dermatologists do the injections, but I do because I think they really work. And if you do those once a month, within, even after the first or second month, all of the irritation goes away. No more itching, no more burning, no more, no irritation at all. And then with time, you get a reduction in all of those symptoms, and you will grow some new hair also. We can't get all of the hair back, but we can get a lot of it back. And even if you just halt the progression of this disease, that is a treatment success, because if you don't treat, the natural progression is to get larger and larger and larger until a large portion of the crown of the scalp is bald.
It's bald. Okay, thank you. And let's see, we have some questions over in the chat room here. This is Carla, who initially asked the question about her 12-year-old and the scars on her legs.
Yes.
She said, thank you for the advice. What kind of dark spot corrector pad do you recommend? And you're going to be humble here, but I will say, when Dr. Woolery-Llyod mentions products she uses in her office, she has a brand, Specific Beauty. Specific Beauty, and it was created with dark brown-skinned women in mind. And it's award-winning. It's won Essence Beauty Awards and Prevention Magazine Awards. So she's going to be humble, so I will be the one to say it. But she has a wonderful award-winning line of products called Specific Beauty. But she can chime in as to what ingredients, if you can't. And stay tuned for the end. We have a special for everyone in relation to Specific Beauty. So hang on to the end of the chat for that. But she can chime in on the ingredients you need to look for again, Carla.
So that the dark spot corrector pad I mentioned is the Specific Beauty one, and that contains kojic acid, arbutin, green tea, and other ingredients that help to lighten those dark spots. And it's very gentle, so I like it for people with sensitive skin. I actually designed it specifically for that reason, because a lot of treatments that are available to treat dark spots can be quite irritating. So, natural ingredients that help pigmentation are licorice, soy, kojic acid, arbutin, and amblyca is another ingredient that's very helpful for pigment. So those are the types of ingredients you need to look for. Niacinamide is another big one that I love.
Thank you. And
we have another question and you know what, let me just say to the people on the videos, if you have a question, please just chime in. I know that you've asked your question because I asked you first, but I want to make sure if there's something else that you just chime in. If not, we will continue to funnel the questions from email as well as the chat room to Dr. Woolery-Llyod. And we have another one from Sandra. She asks, do power-based facial cleansers like Clarisonic work better than using a washcloth?
So that's a great question. Clarisonic is basically a cleansing device that uses spinning brushes to cleanse the skin. And I think it is very effective. I definitely find that my patients like the results, but once again, I always use that with the condition that you don't overexfoliate. So especially if you have sensitive skin, you wouldn't use a power-based tool more than once or twice a week. Otherwise, you can run into problems and irritation. And actually, when your skin gets irritated, you can make your hyperpigmentation worse. So it's very important to use those sparingly. But are they better than washcloth? I don't know if they've been studied, but I would say based on my clinical experience, you probably would get better exfoliation with a power-based tool than just a regular washcloth. It's a little more controlled. The bristles are of a certain firmness that they remove those dead skin cells, whereas when you're using a washcloth, you're using basically your own force, and that's not as controlled.
Great. Thank you so much, Sandra. I actually have an interesting question from Pinda. And Pinda wants to know, can an 8-year-old use deodorant? And if so, what kind?
Oh,
yes, and 8-year-olds can use deodorant. For 8-year-olds, you know, it's a little bit early to start, but obviously we have a lot of young girls who start to have sweating and have some body odor, which is normal as girls go through puberty. So really, you know, the brands that are for sensitive skin are the brands I'd recommend. So it's important to look for sensitive skin. One common one that I use is Dove Sensitive Skin in my patients. And that will be less likely to expose her to perfumes and things. I would choose one that's fragrance-free if possible, because we don't want to irritate that very sensitive skin, especially in an 8-year-old's underarm. So look for any product that specifically says sensitive skin, and also look for a product that's fragrance-free if possible.
Great.
Perfect. Thanks.
I have an old lady question.
Go ahead. Is that Diane?
Yes. The old lady's back. I know. One day, all you youngsters will be asking the same questions that I'm asking. What do you recommend for, like, my skin feels looser on my face, like something to tighten the skin?
That's a very common question I get. I love all of these questions are so relevant because literally every single day in my practice I get the same exact questions that we're getting on this call. So it's good because I think a lot of people will benefit from listening. So basically, as we get older, we live on planet Earth and there's gravity. So even though if you have skin of color or more pigmentation in your skin, you're less likely to have you're less likely to have wrinkles, so lots of fine lines. But my patients with darker skin, everyone gets sagging. That's just due to gravity because we live on Earth. So if you have loose skin, which is very common as we get older, the main things we do are actually lasers. And lasers and ultrasounds these devices can help to tighten the skin. And basically how they work is that they heat up the dermis, which is the deep layer of our skin, and trick the skin into thinking there was an injury so that you produce more collagen. And as you produce more collagen, the skin tightens. So the best treatment for loose skin or sagging skin is actually a procedure. The more common ones that we use are thermage, which is a radio frequency device that helps to heat the skin and tighten it. The tightened device uses laser light to heat the skin and tighten it. And the newest one we have is called Ulthera, or Ultherapy, that uses ultrasound to heat the skin and tighten it. But the main treatment for loose skin are these laser devices, and of course, in extreme cases, surgery.
Okay, no surgery, nothing.
Yes. Well, I love these new devices because I find that years ago, you really only had surgery. That was your only choice. And in the last 5 years, these new devices have come out and they really are effective at treating skin laxity.
Great. Thank you.
You're welcome.
And how careful, just to piggyback, how careful do we with brown skin have to be when we talk about lasers? I know years ago there were so many lasers, even with hair removal, that we couldn't use.
Right.
What do we need to consider?
The great news is that all of the ones I mentioned are perfectly safe in skin of color, and that's really exciting for me because that's a very common complaint in skin of color. It's my patients are much less likely to complain about fine lines and wrinkles, and much more likely to complain about sagging in this area, sagging in this area, you know, where the cheeks get a little bit heavy. So they're perfectly safe in all skin types, and so that's one of the best benefits I see for those devices. And of course, for laser hair removal, we have lasers that are also completely safe in all skin types. The laser that we use is the ND-YAG laser. So if you're interested in laser hair removal, I just saw a patient today who was asking about that and was told that her skin was the wrong skin type for laser hair removal, and she was so excited to learn that there is a laser that's safe for skin of color for hair, and that's the ND-YAG laser.
Great, thanks. Just in time for summer.
Yes.
With the hair removal. Oh, I see Pinda circle back with a question. Thank you for your advice about my 8-year-old with the deodorant. She wants to know, what about baking soda or powder under the arms?
Powder can be okay. Powder is totally fine. Again, I would recommend fragrance-free if possible, because even if you're not allergic to fragrance, let's say perfume on your wrist or perfume on your neck, the underarms are so sensitive that fragrance in the underarms can cause rashes more so than if you use it in other parts of the body. So even if she's not sensitive to fragrances, I still would choose a fragrance-free powder. And baking powder, I would probably choose more a cosmetic powder that's designed for use on the body, because I'm just not as familiar with using that. So I think powder's totally fine. If you can find a fragrance-free version, that would be perfect.
We're looking here. Oh, we were talking about hair removal, and I remember someone emailed us at Beauty Beatbox about, and we have to go there because it's summertime, bikini line.
Yes.
And hair bumps. What do you do? Any advice on treating them?
So just what we talked about. Basically, again, I'm really excited about this because I've been practicing dermatology for 15 years, and maybe 15 years ago there were no options, or no really effective options. But now that we have the lasers that are perfectly safe in darker skin types, that is an absolute 100% solution for this problem. So doing the laser is simple. It's usually 3 to 5 treatments. I would say 5 treatments to get 80% permanent reduction in the bikini. And that eliminates the problem. It's really basically, a miracle treatment. You will not have razor bumps if you do the laser in that area. But lasers, of course, are not covered by insurance. So if you aren't able to purchase a treatment package, then the other option you can use are things that help to exfoliate the skin that contain salicylic acid. One of the most popular ones is called Ten Skin. But you can use anything with salicylic or glycolic acid. You just have to be careful because, of course, the bikini area is a sensitive area and you don't want to burn the skin. The second thing you can do is shave in the direction of growth. So shave downward instead of against the grain of the hair, and that will reduce the likelihood that you will get those ingrown hairs. So shave downward. You can use a shaving cream or lotion that also helps. And then also, you could consider using a electric razor or shaver in that area, because electric razors and shavers don't shave as closely. They remove the hair and cosmetically it will look good, but they won't shave them so closely that the hair becomes ingrown. Because of the problem with ingrown hairs is that when you shave very closely, and of course we have curly hair in that area, when the hair grows out, it pierces the skin because it's curved and causes that razor bump.
Okay, thanks. Keisha, did you have a question? Maybe you tried to chime in earlier.
Yes, I did. Can you hear me?
Yes.
My question was back to the topic of the 8-year-old with the deodorant. Is aluminum chloride in deodorants, is that something that an 8-year-old might be damaging to our 8-year-old's tender skin? Is that
Yes, I'll answer that. Keisha, can you
just
mute one more time, and then I'll answer that. Perfect.
Thanks.
So basically, aluminum chloride is in the news a lot, and people are always asking about aluminum chloride. And really, there are no studies to show that aluminum chloride is harmful, and it is the ingredient in antiperspirants that stop sweating. So I don't have a problem with it in an 8-year-old. I'm much more concerned about the fragrance or other ingredients that can be irritating to the skin. But the aluminum chloride is perfectly safe. In fact, there are some children who have a condition called hyperhidrosis, which is excessive sweating on their hands or in their underarms or on their feet. And we frequently treat those children with aluminum chloride at a much higher concentration that you can get over the counter. So I'm not concerned with using aluminum chloride in that age group. I'm much more concerned about the other ingredients in deodorants that can be irritating such as fragrance, that could cause some itching under the arms.
Great, thank you. Okay, let's see. I have another question. This is an email from Beauty Beatbox, and it's from Tracy in New York. She says, I have oily skin and large pores, especially on the sides of my nose. Sometimes I see black, and I'm assuming that's like blackheads and things like that. But is there anything I can do to rein these under control with the summer coming? I'm scared.
Yeah. Well, oily skin is actually something that when people have oily skin, it's easier as a dermatologist to treat that patient, because that means they can tolerate things that are a little bit stronger. So the number one thing she can use is a retinoid. A retinoid will address all of her problems. And as I mentioned earlier, an over-the-counter retinoid is in products that contain retinol, and prescription retinoids are tretinoin, tazarotene, and adapalene. The brand names are Retin-A, Tazarac, Atrilin is another one, and Differin is another one. So prescription retinoids or over-the-counter retinoids will really help to dry the skin, help to reduce that oil. And the other thing I typically use in someone with a lot of oily skin and blackheads is benzoyl peroxide. Benzoyl peroxide can be quite drying, so 5% is what I typically recommend for someone who has normal skin, 5% wash or 5% gel. But in someone with really oily skin, they might be able to tolerate a 10% wash or a 10% gel. So if you combine a retinoid with benzoyl peroxide, you can really get control of your oil. Now, salicylic acid, if you're oily but not exceedingly oily, is another good alternative, because it's not as drying as benzoyl peroxide. Unfortunately, around 5% of the population is actually allergic to benzoyl peroxide. So some people can't tolerate it, and a lot of people are just sensitive to it. So if you can't use that cleanser and you have very, very oily skin, then you can choose a salicylic acid wash, which is extremely helpful for oily skin. Combine that with a retinoid and you'll have great results.
And again, that will help shrink the pores she mentioned too?
Well, shrinking the pores is a tricky question, because nothing actually shrinks your pores. Your pore size is really genetic. People either genetically have very large pores or they have very small pores. But if you use a retinoid daily, overall the skin texture will improve so that the pores are not as obvious. So I always tell my patients who ask me about pores is I don't want to give unrealistic expectations that, oh, your pores will completely go away and you won't have one pore on your face. That's not really realistic. But I do explain that if you use a retinoid regularly over time, the skin texture improves so much that the pores become much less obvious. And then if someone really has a problem with pores, they can always use a primer that kind of fills in the pores, and that's a very simple cosmetic solution for large pores.
Great, thank you. Say thank you for Lisa.
I have one last question. Our hour is up already.
Oh, our hour has gone by. Okay.
But one last question before we go. This is from Melissa again, and she says 40 is the new 30. How do I keep my skin looking like it? Not just my face, but body. How she keeps this supple, how she keeps it supple, glow, dryness. What are the things that she should?
Well, I love that question because I'm 42, so I love that 40 is the new 30. But so how do you keep that? Well, of course, the most important thing for our face, especially if you have skin of color, is sunscreen. Sunscreen every single day. Because even though fine lines and wrinkles are less of a concern, hyperpigmentation and uneven skin tone is a very common complaint as you get older. Because chronically, years and years of sun exposure, it adds up, and then you get darkening on your cheeks and darkening in the temple area and dark circles under the eyes. So wearing sunscreen every day is extremely important. I can't emphasize that enough. 7 days a week. Let it become a habit so that you always use it. I always keep a little bottle in my purse so that if I forget when I leave the house, I can always apply it when I'm out. A moisturizer with SPF 30, you want to look for a minimum of 30 because typically people don't apply enough sunscreen. So if you pick up an SPF 15 and you put a couple squirts on your hand and put it all over your face, you're really only getting an SPF 5 or 10. So I always recommend an SPF 30 because most people don't put enough on to get the 30. So at least you're getting a 15 or more if you're using an SPF of 30. So that's the first thing. Now for the body, a common complaint is rough skin on the elbows and knees. And for that, I usually use lotions that contain either salicylic acid, lactic acid, or glycolic acid. One of the most common ones that are available is a 12% lactic acid lotion. There are two brands. There's one called Lactin, and the other one is called Lachydrin, but it's 12% lactic acid lotion, and that's very, very effective for treating the dark, rough skin on the elbows and knees. The other thing, I mentioned earlier, laser hair removal is one of the things that I think gives the biggest bang for your buck in the underarms and the bikini, because another common complaint is hyperpigmentation and ingrown hairs in the underarms and bikini, and laser hair removal is a very simple solution for that. The key with Skin of Color is to make sure you use the right laser, which is the Nd:YAG laser, and also to make sure the person who's treating you is experienced in Skin of Color, because if you go to someone who's using the right laser but has no experience, then you can have some bad side effects, and make sure they're experienced in Skin of Color. So, my main things are use a moisturizer with a little bit of acid, whether it's lactic acid, glycolic acid, especially on the elbows and knees. And wear sunscreen every day. Those are the two most important things you can do. One other additional thing I didn't mention earlier is using an antioxidant, because even though sunscreen blocks 97% of the sun's rays, 3% gets into your skin. An SPF of 30 blocks 97%. So you're using that every day, but you still get 3% in and the free radical damage from that 3%. Yeah. So if you're using an antioxidant, you can at least combat that. So those are three simple things that you can do to help maintain youthful skin.
Wow. Thank you. Well, can you see why we love her?
Keisha?
Keisha. Oh, Keisha had a question.
Yes, do we have time for one more question?
I absolutely do.
Stretch marks. Is there any topical or laser solution for stretch marks?
Good question.
Sure. Okay, mute your microphone. Perfect. Okay, so stretch marks are one of the most common things. Again, I saw patients today complaining of stretch marks, and they are more common in Skin of Color. In fact, in a study where they looked at women who were pregnant, the predictors of stretch marks were your ethnicity. So obviously it was more common in darker skinned patients. It was another predictor of stretch marks is how much weight you gain during pregnancy. And those are the two most important things that help you predict whether you're going to get stretch marks from babies. So stretch marks are definitely a challenge, but we have studies that show that retinoids, like that retinol I mentioned, or prescription retinoids, can help new stretch marks fade a little more quickly. And then for existing old stretch marks, there are a few laser devices that have been somewhat helpful. But again, with stretch marks, I always like to set realistic expectations, because there's no treatment out there that completely eliminates a stretch mark. In some ways, a stretch mark is like a scar. So there's nothing that completely eliminates where your whole stomach or legs are covered with stretch marks, and after using that treatment, they're completely gone. But there are things, mostly things that help to exfoliate and resurface the skin, that can help to make them less apparent. So my number one recommendation would be to look for a product with retinol or a prescription retinoid that you can use. And there's some good ones on the market that could be helpful. And then if you have a dermatologist or a clinician who's really experienced in ethnic skin or Skin of Color, who has a device that we use to kind of resurface for stretch marks, it's one thing you could try, but you have to go in with realistic expectations. You should be happy with a 10 to 20% improvement. If you would be happy with a 10 to 20% improvement, then I would consider it. But if you're expecting a 70 or 80% improvement, then I would save your money.
Been great, everyone. Thank you so much for being a part of our webinar today, and thank you for the brave souls who decided to come on the video. We really appreciate it.
I know we appreciate it.
We appreciate that. Like we are known for, Beauty Beatbox, we want to bring beauty to your doorstep. So not only do we bring you the products, but we bring you the top experts in their fields to talk to you personally about your beauty. So thank you, and please log on to beautybeatbox.com. And Marcia, do you want to talk about the special, the specific beauty
Yes.
promotion?
Yes. Like we said before, we have a special treat for you. Dr. Woolery-Llyod has given us a coupon code to use on her website, specificbeauty.com, and that's SPECIFIC beauty.com. And it's no small offer. It's 50% off your entire purchase. So you can stock up for the summer on your moisturizers, your sunscreen, your dark spot corrector pads. Get all of that and get 50% off. It's exclusive to Beauty Beatbox and this chat. So it's only for 3 days, and you all are the only ones who know about it. So please do take advantage of it. So starting immediately following this chat through Saturday midnight, which is the 31st, you can get 50% off. And we thank you, Dr. Heather Woolery-Llyod, for that offer. That is amazing.
Well, thank you for inviting me to be here. This was great, and the questions were fantastic and really relevant to everyone, because everything that was asked today I hear every single day in my practice.
And you see why we called on her time and time again during our beauty editor days for advice. So we hope you leave here today with some strategies and tips and an ingredient list to shop with, so you can have your best skin ever. Although I must say, all you ladies look beautiful. I see clear skin across the board here. And thanks to our chat room guest as well. And stay tuned for our next chat.
And look for more specific beauty in the Beauty Beatbox. Thank you, Dr. Lloyd.
Yes.
Thank you.
Enjoy your day, everyone.
Oh, real quickly, I see Carla just said, I just ordered the corrector pads. Thank you.
That's right.
Quick, she's on it. Okay.
Thank you.
Thanks again, everyone.
Thank you, Beauty Beatbox.
Oh, you're welcome.
You're welcome.
This was great.
We'll chat soon.
Have a great day.
Bye-bye.
Bye-bye.
Bye.